Wikidonist.com. Truth about tooth.
Hi friends, you might have seen this ad on the TV all the time saying that tooth sensitivity is something really weird stuff. It is actually difficult for people who are having sensitivity. Most of the people who are listening to me might have had some amount of sensitivity at least for a day. There are transient sensitivities just after having something like very sweet stuff, or sometimes with the caries you might have experienced it, or even if you want to have sensitivity, if you have never felt it, you can just take a little bit of, I'm just telling it as a joke, if you want, you can take a little bit of lemon and squeeze in your mouth for quite some time and keep it in your mouth. So you might get a sensitivity when you have cold or hot water. So this is how you can check it out. How, if you have not felt it, you can do that. But I'm not recommending it. But if you don't know what is sensitivity, you can try that out. But why I told you is actually the first and foremost reasons for sensitivity is actually acidic media, which is actually eroding. Whether it is caries, it is actually bacterial acidicity, which is actually causing the calcium to decay off from the enamel and then giving you sensitivity, or even the sensitivity is caused by using acidic drinks. The third reason is acidic drinks, right, like Coca-Cola or Pepsi, or even other acidic drinks like even fruit juices and things like that. You should not actually keep it in so much of time. Normally if you drink, there is nothing happening. There is a lot of hue and cry about taking the acidic drinks off, but you have to drink something, right, like fruit juices. It's good. So it doesn't make any sense by banning all this stuff, but it is always good if you can actually keep the teeth off the drink as early as possible, so you don't have to swish it around, keep it in your mouth and things like that. You can just enjoy it, have a drink and then finish it off. Why I am telling you is because if your exposure to the drink is only for 10 minutes or something, another 20 minutes of exposure to your saliva, it just gets recalcified, so that's okay. But when you are having like gastric regurgitation and stuff, you still have acidicity which comes into your mouth. If you are a bulimic person who has a lot of stress and things like that, the gastric juices comes into your mouth every now and then. That also can cause acidicity in mouth, and then it can cause sensitivity. All these cases, actually we can do a lot of desensitizing paste and things like that. There are GC mousse like stuff which is actually calcium supplying agents, which can, even some toothpastes are there which are actually pro-calcium hydroxyapatite based toothpaste have also come, which can actually supply calcium to recalcify the enamel which is there. So all these things can be used. Even desensitizing paste can be used in such cases to some extent. But all these things has to be done, monitored under a dentist, because that will actually give you much more professional advice, and it can be corrected. So that is one of the reasons. The other reason is actually caries. So that is why we tell that you have to go to the professional, take a professional listening, because if you have a sensitivity, and if you are actually taking a sensitive paste, you will not know whether it is from a caries or not. And if the caries goes on, and then it can go into infections, or it can just break the tooth. So I don't want you to lose the tooth. I don't want you to go into a root canal treatment. So you better go to a dentist, check it out whether there is any caries in your mouth, and then you can use a sensitive paste if it is just minor sensitivity. But still, I will never advise you to go on, continue using a sensitive paste, because that will actually take it for granted, and you might get caries and you might go unnoticed with your caries. Especially people with bridges and crowns, if you use a sensitive paste, you will not even see whether there is undermining caries which goes under the crown. So please go to the dentist, have a look at it, and if the dentist says okay, everything is fine, you can just use a sensitive paste for some time. That is how to use the sensitive paste. The sensitive paste has to be used for 10 minutes. You have to apply it over there, and then you can brush with the same toothpaste, or you can use a toothpaste to brush your teeth and then use the sensitive paste to be kept for 10 minutes and just wash it off. That's also possible, because I need time for the toothpaste to react with your enamel and dentin and things like that, block the dentinal tubule so that you will not get any sensitivity when you have food, and sensitivity when you have very cold food or water, whatever you are having. So please make sure that you do that way, rather than just spending time and just spending money to use it just like a toothpaste. It doesn't help. So what is the other treatments for sensitivity? There are clear-cut treatments for sensitivity by like laser. There are phosphorontosis and things like that, where we can actually reduce the penetrability of water and the movement of the water inside the dentin. So that is possible. The other way is, if at all the sensitivity is too much and if there is a lot of gum recession and things like that, then we'll have to go for root canal treatment. The gum recession is one of the reasons, major reasons for sensitivity, because the gum recession, if it goes on, there is no enamel in the root area, so the dentin is exposed as soon as you brush, and the cementum will go off, and the sensitivity will kick in because of the dentin which is exposed outside. So in that cases, we may have to go for some desensitizing agents and desensitizing therapy. If it is still persistent, then we might have to go for root canal treatment, so that we can just take off the nerves and keep you off all the sensitivity. So these are the different ways of treating, and these are the reasons. So my major concern is, don't treat it yourself, because if you treat yourself, you might end up spending more and losing more teeth. So please don't do self-treatments when it comes to sensitivity. Please get a professional advice and find out why it is sensitive, and then get it treated with a professional dentist. You can go for a flap surgery if it is gum issues. If it is a gum recession, we can do flap surgery to correct that also. I have already spoken about all those things. Please watch and subscribe and spread the news about having a dentist talking about all these things. Please send it to all your friends who are having sensitivity, or if you find somebody who is having sensitivity while having an ice cream, please send it to him. There is somebody called as Dr. Thomas, and just introduce my videos so that they'll also know what can be done for sensitivity. Thank you very much. Dr. Thomas Nechupadam from Nechupadam Dental at Marine Drive, Kochi. Kochi is a nice place. Please come enjoy our place. Thank you very much.
Wikidonis.com